Back here on Sports Medicine Weekly on this Saturday morning, and a reminder, net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the LiveActiveNow.org fund. I'm Steve Kashul with Dr. Brian Cole. We come your way each and every Saturday from 8 to 9 a.m. only on 670 The Score. Dr. Cole, boy, how prevalent is this? I mean, a lot of athletic programs, it can be boys or girls, baseball, basketball, football, hockey, whatever. They really don't have immediate access to a certified trainer or doctor on hand during these practices and most games. Would you agree?
Yeah, no, it's a luxury to have a trainer. And you just think about all the public schools, the soccer clubs, hockey. There's hundreds of teams just in Chicago alone, and there's no practical way to get sort of immediate medical attention. So really the crux of it lies in the coaches, and they're the ones who have to recognize some of the guidelines now, for example, pitching guidelines. They're the ones who have to recognize when there's an injury and have to have the sense and the knowledge to sort of make proper recommendations so that a kid can stay in the game. So it's a really important aspect, I think, that gets lost, especially because the numbers of young people that are involved in sports is so much greater than anything else we see in the collegiate or professional level.
Well, let's bring on a guest here coming all the way from San Mateo, California, Dr. Dave Mishra, an orthopedic surgeon who is the founder behind a company called Sideline Sports, and it started back in 2010. Dr. Dave, thanks so much for joining us here on this Saturday morning. Can you tell us about Sideline Sports Doc and how it kind of files into what Dr. Cole and I were talking about?
You bet. Steve, Brian, thanks so much for having me on. It's a real privilege to be with both of you, and I appreciate that wonderful introduction there to the problem. I think that you both really hit the nail on the head there, that what I had felt all along, and you both have articulated this real nicely, is that there's an underrepresentation of common knowledge that the non-medically trained youth sport coach should have on the field of play, because after all, they are the first responders to most injuries, and as both of you have said, there's not always a certified athletic trainer around. That would be a wonderful thing if we could have that, but they're not always there. And this is especially true at the club level, where not only are there typically not athletic trainers, but most of the coaches who are participating are volunteers, and the vast majority of them are going to have no medical training. So the idea behind what we wanted to do was to see if we could provide a simple methodology that a non-medically trained coach could call upon on the field of play to make a go or no-go type of decision. Your player's been injured, now what?
So, Dave, are these now? Do you have sport-specific modules, and who's actually using the service now?
Sure. So, what we did was take the common 4 aspects that any physician or athletic trainer would do on the field of play. We made an acronym behind that called the SAFE method: story, appearance, feel, and effort. And this is a universal evaluation method. It could be used for any sport, boys, girls, any age group. And what we do then is to make it sport-specific. For instance, the hockey players don't necessarily need heat illness, and we're able to take this methodology and customize it for any given sport. In terms of who's using it, Brian, we've had about 77,000 coaches nationwide so far take the course, and there have been coaches in all number of different sports, but we've so far had a huge acceptance in soccer, and so I think
does your dog need to be walked this morning?
Yeah, we do hear the dog.
My dog's out there. I'm trying to figure out how he can get in on this conversation. Apparently he's having way too much success. I apologize.
That's okay.
That's all right.
No worries. It's okay. A lot of dog lovers out there. Don't worry.
I'm sure somebody at the Score can figure out a way to erase him from this conversation. Oh, man.
It's okay.
You guys
Go for
are good,
it.
I know. So where I was we've had a really strong representation in soccer, also in flag football. some in hockey, some in lacrosse, but those have been the principal areas that we've been focusing on so far.
Dave Mishra is our guest, the orthopedic surgeon from San Mateo, California, and the founder of Sideline Sports Doc. And Sideline Sports Doc, DOC.com, is the website. And can you describe for us, Dave, the coach certification program?
Yeah, absolutely. So the way that the program's presented right now from the coaching perspective is that they get a online platform which combines video, audio MP3. If you're super challenged for time, you can download the audio MP3 and listen in the car on the way to the practice field, and also an ebook. I'd like to add also that Dr. Cole as well as Dr. Kathy Weber have been key contributors on the video content, and they've been absolutely terrific and helping us provide that content. So the coach can learn the material any way that they want. They then answer a series of quiz questions that then results in a certificate of completion.
So, Dave, you and I have been working on this for a long time, but really mostly you. And, what's your vision going forward? Where would you really like to take this program?
Yeah, so I think there's a couple of places. So first of all, in terms of the coaching education program, we've only made a tiny dent in the areas where we would like to go. We would like to get further expansion across a number of other different sports. We're currently talking with a couple of national governing bodies for sport, which will be a terrific inroad for us. Other opportunities are professional teams that have community outreach programs. A number of them have fantastic programs in place where we think that the health, safety, and education component of this piece could be really important for them. And then the other area that you've touched upon are middle schools as well as high schools who don't have access to an athletic trainer. The other aspect, though, I think are the parents. And what we've learned from the early experience with the coaching education course is that it's been extremely well received. The coaches get it. They find that it's easy to learn, it's fast to learn, and it's reliable for them to use on the field of play when they're in the heat of battle. And many have said to us, why can't you take this method, turn it into an app, and have it usable for somebody who is, sitting around the dinner table at home after they get home from the game? So that's where we're going next. We're developing an app around the SAFE method that is going to be, I think, principally focused on parents as well as adult athletes, weekend warriors, who could, I think, benefit from the same type of knowledge, but don't necessarily need to have that in the back of their brain where they have to have it in a minute and a half. They can have the luxury of being able to take a look at the app and guide them through the steps.
And what's the app exactly, Dave?
The app's going to be called, at least tentatively, Good to Go, and it's kind of the common phrase that we would use at the end of a go or no-go decision. And we expect to have it launched in the next 4 to 6 weeks.
Fantastic. I'm going to ask both Dr. Cole and Dr. Dave Mishra, who's our guest right now, the orthopedic surgeon from California who developed the Sideline Sports Doc. Gentlemen, doctors, take us through a scenario where, a parent or a coach that's not certified is watching their son or daughter participate, and they've got to make a decision. The kid says, I'm all right. I've got something with my knee right here. I'm limping, or maybe not as serious as an ACL, but, how do you make the decision?
I think that, Dave, correct me if I'm wrong, probably the best example is a concussion. How does everyone knows about concussions, it's in the media and so forth, but, when it comes down to actually making a diagnosis, to at least having enough of an inference based upon what just happened on the field, I imagine a lot of coaches might be uncomfortable with that. It's just not part of their training and their purview. That's why, your point is about the parents. I think if parents are listening out there, Sideline Sports is something that they should introduce to their coaches. And I think this is just a matter of time where they're going to catch on and say, look, I don't want to be in a situation where I make a bad decision. So I have to imagine the concussion would be the best example, right?
Yeah, I think it's a really terrific example because, Brian, as you just say, everybody kind of knows nowadays that concussions are something that you need to be on the lookout for, and they're important not to miss. And yet, I think the practicality of how a non-medically trained person goes about making that assessment isn't as well taught, I think, as it could be. And that's what we're trying to do is give them a really simple methodology that they can just rely upon. And much of what we do, Steve, is based upon what we would call red flags. And so in each of these assessments, if there's a red flag, that's okay, remove from play, get help. It applies to concussion. It applies to any number of other different things. And that's what the method helps them do.
All right, we're out of time. Dr. Dave, take us through the website. And again, best ways to make people more aware of what you're doing. I'm on the website right now, and you also have a newsletter there, correct?
Absolutely. So Sideline Sports Doc, DOC.com is the website. And we'd love for you all to take a look around the site, take a look at the blog, and leave your comments. Let us know how we're doing, and please suggest ways for us to make things better. We're always looking for ways to make ourselves better and deliver things that matter most to each of you.
Well, good for you guys, because there's not enough trainers, right, Dr. Cole, out there,
No,
and certified athletic people that can help with injuries.
No, there's probably far more coaches than there are trainers out there, and they're on the front lines as well. So I think this is a really novel, innovative program, and I'm really a huge supporter. And Dave, we just got to continue to get the word out there.
Absolutely. Hey, thank you both. Really terrific to let me be a part of your show.
Dr. Dave Mishra, thanks, Dave. We'll talk to you soon. Be safe out there in west coast of California. And I'm back with more of Sports Medicine Weekly. When we return, Dr. Cole and I do our segment we call Ask the Doctor. Always some good questions from the listeners. You can find that on our website on the main page. We'll be back with the questions after this as you're listening to Sports Medicine Weekly
on 670 The Score.